speakers, we would like to invite everyone to post their questions if they have any in the Zoom chat box. But right now we collected some and we would like to address the questions. So the question answer session has begun right now. It's panel discussion. So first question is for Dr. Nagesh. It's from Zareen Nawar. So the question is, what does a medical science liaison do exactly? So Dr. Nagesh, can you please answer the
No, so I was going to say that, you know, as the name suggests, the medical science liaison is a liaison between the industry or the company and the healthcare provider community outside. So as in this role, an MSL, you know, responsibilities include talking about the mechanism of action for a drug or a biotech or a device, being able to share what else is, what other applications for, you know, the compound are being explored outside, to talk about collaborative research with the industry or with the company and between the physician and the company. And so, you know, think about it as being able to continue talking about the science and advancing other possibilities for the science and with the product that a company makes. I'm sure there are probably some MSLs online, and so if anybody wants to chime in, please feel free to do so.
Okay, so thank you very much, Dr. Nagesh, for your informative answer. I will be taking a second question, which is directed towards Dr. Aftabul Haq. So this question is from Dr. Niaz Rahim. So the question is, how challenging is it to move from academia after postdoc for a few years in academia to industry? Dr. Aftabul. Thank you.
So it's a broad question and the answer is also broad, but I'll try to concise the answer. The first challenge is within yourself. And I'm telling that from my own experience. I have been in academic research for a long time. And when I was trying to make a transition, I had to fight with my own self to make the transition. And there are so many different things to adjust, because in academia, the situation is different. There is a lot of independence and liberty. We can choose our own project, but in industry, we have to mold our own interest with the industry's goal. And the move itself is challenging in that way. There are a lot of jobs, but to land on those jobs is not easy. As I try to explain in my presentation, that there is a lot of homework, and you have to allocate some time in a regular basis to do some homework, do some searching, developing some network, so that you can efficiently find a job that you like. Of course, you can land on probably any job, and that may not be something that you like, and that is not a good combination. And I would not suggest to just join in a position just for the sake of joining any position. And that is not, in the long run, that is not a good outcome. So.
Thank you, Dr. Haq. That was very nice answer. Our next question is towards Dr. Abir Ashraf. This is from Ontora. She asked, how many years does it take for the drug to hit the market? In your slide, you showed that you explained the duration, but how long it takes for a drug to develop? Dr. Abir?
Thanks for the question. Actually, I don't think I talked about the duration of drug development in my slide. It varies a lot, actually. It varies a lot in terms of it's a biological product or it's a small molecule product. Also, it will vary depending on how much resources the company is interested to put in behind the program. If we're talking about an oncology program that has a life-saving benefit compared to existing therapy, so the company will align all the resources behind that program to expedite it. And oncology clinical trials are a bit shorter. Compared to think about an anti-hypertensive product or anti-diabetic product that will add to a convenience. For example, patients are taking once daily, and this product has once monthly administrations. It's more of a convenience issue. So when a company is thinking about a priority to select one of these two, the anti-diabetic product may not get the priority and may not get the resources. It will delay the program. But typically, it's a very general, as I said, it can vary. It's about 10 years for small molecules to develop the product.
Thank you. That was a very good answer. Our next question is Ms. Fahmina Jahan. This is from Dr. Niaz. She asks, can you suggest any diploma training which can be helpful to get a job in QA in North America?
Yeah, there are several courses. In Canada, you have TIPT, one organization. They conduct actually a regulatory affairs course and a quality assurance course that is 1 year length. And Seneca College, they have also regulatory, I would say diploma, two years regulatory diploma that tremendously help any person to get into the industry, specifically pharmaceutical, because the Seneca quality assurance, regulatory affairs and quality assurance course is heavily designed with the pharmaceutical background, pharmaceutical activities and regulatory affairs. So that course is very helpful to get into this position.
Okay, thank you very much, Ms. Fahmina Jahan, for your excellent answer. Our next question is for Dr. Nagesh. So it's from Idi Aminojoy. The question is, if I want to start a biotech company, where do I begin from? So Dr. Nagesh, this question is for you. Thank you.
You begin with having an idea and seeing an IP attorney. You need to get your IP in place before you actually go out and seek funding or talk to any other collaborators. So that would be the first place to start. And then obviously, you know, once you have that secured, then you'd have to find funding to get some of your basic work started and, you know, do some prototyping or molecule development and do some preclinical activity. And then if you have promising results, you know, in animals, then you would take it into and scale it up into clinical trials and so on. But, you know, getting your IP protection in place, getting a proof of concept in place, and then raising capital would be the way to go.
Thank you very much, Dr. Nagesh, once again. This question is for Dr. Aftabul Haq from Nuri Alam Siddiqui. The question is, what is the basic difference between academic and industry research? So Dr. Aftabul Haq, thank you.
The basic difference will be the goal. So in academic research, and also the two basic differences, in fact, the basic differences would be the question you ask and the goal you seek. In academic research, the question could be very broad, very basic, and it does not have to be oriented towards a particular product. But in industry, both the question and the goal that the question is seeking, both have to be product specific. And also in academia, we sometimes do research with the goal of publishing the research and also applying for funding. In industry, we don't have this. We don't have to publish, or I mean, it's not a mandatory thing, or we don't have to apply for funding. The only thing in the industry we have to focus always is everything we do that has to culminate into a product. So that is the basic difference.
Thank you, Dr. Aftab. Our next question is to Dr. Noor Hassan. This is from Mohi Uddin. What would be your advice to undergraduate student aspiring to enter the world of biotech?
Wonderful question. And as I said, that you have to start early. So undergrad area is the perfect time. You will get ample opportunities. So there are two sides of it. As a student, you can do a lot of things. For example, you could get a few critical skills that is needed for biotech industry to enter and to excel yourself, like communication skill, problem solving, technical proficiency, to working in a team and meeting to deadlines. But most important things, you try to to get some experience, like for a volunteer or internships or a part-time job in some industry environment, know how they operate and how they excel, how they work. Basically, familiar yourself with the culture and the dynamic of the biotech industries, and build some connections. And because in an undergrad, that's the best opportunity. You can show up and find people through LinkedIn and say that, hey, I just am just very much passionate about the technology. Can I come for work? Every year, like the biotech I was involved, we had to take a lot of undergrad students, and many of them, those who really show the attitude, basically the very good attitude that they can be trainable. You can train them for skill. We actually try to pick them later on when they graduate. Additionally, I will say that our academic syllabus and other things are part of the things that Dr. Nawabur Rahman mentioned, is that I think we are at a stage for microbiology, being a very research-oriented subject. We need to add some leadership type of courses, some courses that can expose them to entrepreneurship and commercializations, etc. And also give them some flavor of how to innovate. Like even in undergrads, we do a lot of work, and many of us has some innovative ideas, and how to actually take in ideas and imply or apply their innovations to get something. Problem solving, basically small problems solving. And during your undergrad, you record and document them in a way that in the future, when you are called to an interview, you can emphasize on that this is what you have done. So this will be a showcase to portray that you are a very potential candidate, fit for the environment with a lot of hopes, and you are trainable.
Thank you, Dr. Noor Hassan. Our next question is to Mr. Nawabur Rahim. This is from Idi Amin. What are the other criteria that one should have other than microbiology to join the pharmaceutical company? Idi Amin, if you are in the audience, can you unmute yourself and ask the question?
I was just asking, like Sir just told that microbiologists can join rather than the microbiology specialized sector in the pharmaceutical company. So what other qualities or degrees or criteria you should fill in order to join those categories? Like those are not for only specialized for microbiologists.
Oh yeah, definitely. Microbiologists, right, when they are really, starting their, core job as a microbiologist, there are potential areas, right? Pharmaceutical is a multidisciplinary function, right? Once somebody really proves themselves as a worth for the company, right, there are so many avenues and they are so interrelated, one function to other, right? Suppose somebody would like to join as a microbiologist, right? After working at a length of like 5 or 7 years, right, he can really work for QA, right, provided he really learns about on the job, because the people really learn, right, microbiologists, whoever the professionals they are coming in the joining, because there is a kind of also training ground, right, they can learn a lot of things on the job. 80% learnings that comes from the job, right? So they, provided they have got the right kind of attitude, that attitude also came out during this session, right? Nowadays that employers in fact hire attitude, not only the skills, core skills. So it's very important. If they would like to grow like vertically, he can grow vertically. If you'd like to really grow horizontally, he can also grow horizontally.
Very much. Thank you very much, Mr. Nawabur. I have another question. This is directed towards Mrs. Fahmina Jahan. This is from Zakia. She said she has done her master's degree in pharmaceutical science from Jahangirnagar University. She has also worked in international regulatory affairs in Incepta Pharmaceuticals. If she wants to start her career in regulatory affairs in Canada, will pursuing PhD in regulatory affairs be enough to start the career? And what are the other options except for PhD? Please suggest. Thank you. Mrs. Fahmina Jahan.
This is very interesting question. I really need to tell you one thing, that regulatory, to start a job in a regulatory, you don't need to do the PhD in regulatory affairs. You really need experience. You need to know the regulations, and I'm not 100% aware what kind of regulation Bangladesh currently following. If you want to move into North America, you must know the regulations from FDA, Health Canada, this kind of regulatory bodies. And if you want to pursue your career regulatory affairs in Canada or in North America, you can prove your experience is relating to that job, and then you can get into this job. This is very common, and this is not very unusual thing. Everyone gets job by utilizing their previous experience. For that, for getting into the industry, what you need to do, as I showed you, that previous experience, you can get into co-op opportunities, because employers, they are actually very conservative, because they don't know you, they don't know your country, they don't know us. So they really want to see that person's personality, person's behavior. So to prove that, to show that, we need to have some kind of openness to get into the industry as a co-op or internship. So your experience, I can definitely say, yes, it is possible. You just need to correlate your experience to get a job. You do not need any PhD to get into a regulatory affairs job.
Thank you, Famina. Is Dr. Abir Ashraf or Dr. Nagesh would want to chime in to say a few words about the regulatory affairs and how they can get?
I think Dr. Jahan addressed it really well. She's absolutely right. You don't need a PhD in regulatory sciences to get a job in the regulatory affairs kind of industry. But Dr. Absar also, by the way, I'm a Texas Tech alum as well. So it's co-raters.
It was very see that.
So like he was saying, it's getting your foot in the door is going to be a little challenging into the regulatory affairs world, especially if you're transitioning from the lab and you don't have any prior experience. But there are multiple ways to do it. I mean, reach out to people who you know. By the way, a lot of them in the audience right now, you're building your network. Everybody who is on here, who is part of the panel, I would strongly encourage you reach out and explore any possible opportunities that you can find. But once you get in there, you'll probably start at ground zero. But then, as I was saying, with regulatory affairs, once you get your foot in the door, every year that you work in that domain, you keep adding experience. And then you don't need a PhD, but once you have 2 years or 3 years of actual hands-on experience, you're able to sit for the RAPS certification. At least in the United States, there is that is highly accredited and valued if you have RAPS certification. So it can be tricky to get a break, but once you do, with the education that you already have, you should be in a good place.
Yep, and I totally agree with what the previous speakers just mentioned. So getting into could be a little bit trickier. Multiple reasons. When we have some regulatory experience, you mentioned, I think it's but those regulations are very and not very tailored to drug development in North America. You mentioned Canada. So understanding the Health Canada requirement would be required. I would say at least some understanding. And if we're talking about America, also some understanding about the FDA regulation would be very important. And another challenge coming directly from Bangladesh to getting a regulatory position within North America could be usually, I mean, regulatory positions, you are the face of the company when you are interacting with the regulatory agencies. So that the communications be very, very critical in that regard. So that could be one. Usually when I transition to America, I definitely have to overcome the initial barrier of communicating with other people, to understand their lingo, understand the expression, because those become very tricky. So that could be another area you want to improve to get into a regulatory position directly. But the safer route would be to get in some other fields and transition to regulatory down the road.
Just to add into that one, if just 1 minute, as per my job responsibility, I have to face actually FDA, Health Canada, all regulatory bodies. So what Abhi mentioned, that is extremely important. Not you just don't need to know the regulations. You need to communicate the regulations that you are following, your company is following, and your drugs are manufactured according to the regulatory requirements. So that communication is extremely important. Not only technical, this is also I would say very soft skills. Soft skills should be very very top of the priority. That's it.
If I'm just allowed to say a few things on top of Mr. Abir's here. So being Bangladeshi pharma industry, since we have gone into the regulated market, so that requirement, that the regulatory prospect is very, very high, right? And the communication with the FDA, right, particularly for the CMC part, right, since we are really commercializing a lot of things, a lot of products in the US market, right? So the queries that are coming, right, the regulatory part, right, is a very, very vital. Right, there are also time limit, like particularly for the field alert and some other important queries when it's come, like it is coming, right? There is a kind of time limit, and unless someone has got the developed knowledge, as a complete knowledge about the product development and also the regulatory sciences, they cannot really reply to the expected level that they are expecting, FDA particularly.
Okay, so I actually have a few questions for Mr. Noabur Rahman. This question is from Dr. Niaz. Is there any opportunity as a scientist in big pharmaceuticals like Square in R&D following PhD?
Sure. We have a lot of PhDs working as part of our R&D team, and we are truly a kind of multicultural, right? We have a lot of people coming from different part of the world and working as a team, right? So being a scientist, right, definitely if he is having a kind of PhD degree, has got certain value added already, certainly he can apply, and definitely that will be considered.
Thank you. Our next question is Dr. Aftab Haq. This is from Maher Mansoor. For R&D jobs in pharmaceutical industries, how necessary it is to do a postdoctoral fellowship?
It's a very good question. This is a question that, in fact, a lot of people think about. And the answer is there is no need for a postdoctoral fellowship or research for joining an R&D position. One can directly join after completing PhD to the R&D scientist position in USA or in some Northern American country. But it sometimes depends on the job requirement because in many jobs they want some sort of research experience after PhD. So in that regard, postdoctoral research is one kind of research experience, but if that is not required, after finishing the PhD, one can directly join.
Thank you, Dr. Aftab. Our next question is to Dr. Noor Hassan. This is from Monwar Hussain. Is it possible to apply for a North America job position from Bangladesh?
Yeah, it's a tricky one. It's possible, but there are also some barriers there. So as you see, as I say, is that there are different types of biotechs depending on what type of biotechs you are applying for. Like definitely for a small or startups or small to medium biotech, I will say your chance is very thin because of the residency requirement or H-1B visa. To maintain that, like biotech industries have to go through a lot of processes. Small biotech or startups, they don't want to go through that. Like I have been in 2 biotech industries. A lot of the time I tried to do so, it simply did not go through because of too much requirements in the legal aspects. However, in a medium to big pharma biotechs, it is possible. They have an established HR and they have these legal things has been sorted out by some attorneys, so they can do so through H-1B visa. It is possible.
I'll just add to this. So what Hassan said is generally the case, but there are rare cases. For example, if you innovate something that is groundbreaking, groundbreaking innovation in any field, and that is also published, or there is some kind of media involvement in that, and people know about the innovation, then you're in a different position. You can directly contact in any industry that is directly involved with that innovation, and they will invite you to join them. So there are always exception to the rule.
Can I add to one thing to that?
Sure.
From Bangladesh, can they apply for this position, any position, right? That was the question.
True.
Yes, it is possible. Absolutely, anyone can apply from Bangladesh. The question is if they are getting into the job or not, whether they can get the job or not. Because I will talk about only in terms of Canada. When an employer posts any job posting, they need that position to be filled up very quickly. So for applying from Bangladesh, there is some technical issues. You can apply, you can have an interview. However, there is a visa issues. There is a status, like status means immigration status issues, or what kind of status you are bringing in with you are having to come into Canada. So this kind of because of that, because I'm in the part of hiring, so I know what kind of struggle we face all the time. So when we see that person doesn't have any visa or work permit for that for job in Canada, we do not particularly ask for interview, because we know that so many hurdle will be there to get that person into that position, and it will take us a significant amount of time. So employer cannot wait so long to get into to fill out that position. So these are the main hurdles.
Thank you, Mona. Next question, actually, I would like to ask both Nawab Bhai and the North American speaker as well. So if someone has a BSc, this question is from Tishita. If someone has not a master's or PhD, just has a BSc in microbiology, what are the career opportunity in pharmaceutical industry? First Nawab Bhai, then I'll open up to North American speakers.
Yeah, definitely. If it's a kind of 4 years degree, certainly she can start her job in provided she gets the opportunity. But as long as the number of candidates are available with master's degree, right? Normally, when employer, in fact, review the cases, right? If they get someone with both honors and masters, right? They prefer, right? Because what happens, particularly after the employment, that candidate, particularly, she tries to finish her master's degree while she starts, or he or she starts her course, right? His or her course, right? So that's the kind of industry has got to take that pain, that that some has got to take, you have got to take spare her for a study, right? So it does happen. It doesn't happen, I will not tell, right? It can happen. It also happened before, but since nowadays there are opportunities are less, the candidates are more, right? So particularly the pharma industry, they are very, very conservative, particularly hiring only the plain graduates. But I would not say that you cannot, but provided she can make that plan later some time, right? And if she has got she is found promising, definitely she is hired for the organization.
Thank you, Dr. Nawab. Someone from North American can want to join?
I would like to add a little bit there.
Sure.
With bachelor's, your horizon is as equal as for many, even after PhD. But the main thing is you can go to biotech easily. And there are different positions. Your requirements are position specific. So if you have a bachelor degree, you can definitely apply for entry positions. And certain part of the biotech doesn't actually require master's or PhD. For example, bioinformatics, genome analysis, next-gen sequencing. Over there, a bachelor degree with good training is good enough. I have seen in my career that there's a lot of bachelor degree, like kind of a candidates or employee with bachelor degree is excelling very good in their career. And particularly, if you think about the little bit of computational biology or bioinformatics or data science, your bachelor degree and then having some exposure in data science and sometimes master degree is more than enough to excel in your career. However, if you go to very research-oriented oriented places, like you want to be one day a chief scientific officer, that's where you need a master's and some PhD with a balance of experience and your educational qualifications.
I can give a little bit of insight from my experience. If your bachelor degree is equivalent to Canadian or US bachelor degree, you actually do not need any other degree to get into a pharmaceutical industry. That could be an asset, your MSc degree and your PhD, but these are not the requirements. By regulation, by pharmaceutical industry, these are not a regulation. These are not a requirements, I would say. So to get into the industry, bachelor is more than enough. You need to get into the industry, and then from your when you obtain your experience through working with different departments, that experience will bring you to your desired position. In my I would say network, so many directors, VPs are there. They do not have any other degree. They have only bachelor degree, but they have a huge, tremendous experience in their field, in the full industry. So you should be very comfortable to apply for any position with your bachelor degree. For entry level, I would definitely mention.
I'm going to add a couple of words from my understanding about getting a position in big pharma. So I believe the question is asked, like the bachelor degrees from Bangladesh, not in either Europe or North America. From my experience, I have not seen anybody yet who has a bachelor degree from Bangladesh and was directly pulled from Bangladesh and brought into America. I mean, who got into a big pharma right from Bangladesh, because I just cannot understand how it will work from a procedural perspective, because those have to sponsor a visa. You know, I don't say I don't want to give you a false hope, but on the other hand, if you're coming from Bangladesh to either Canada or USA, is on a separate route. Say you have an immigration or in some other route you are coming, you're already in, then yes, you can always approach and you can always get into. But just from Bangladesh to America directly to a bachelor degree, it will be extremely challenging because of the visa-related issues.
Thanks for adding the immigration part. Thank you very much. It was very helpful. Yeah.
Okay, I want to talk about Mozammel Haq.
Yes, sir. Go ahead.
Thank you. I am proud of my students, Dr. Aftabul Haq, Hamina Jahan. Oh, she is doing great. Quality control manager. Also pharmacist, Mr. Abir Afsar, PhD, and Dr. Nur Hassan. Last but not least, Dr. Nur Hassan. Products which are produced by microorganisms, produced by fermentation. Many of the pharmaceutical products, it is not only antibiotics, vaccine, and also some other useful proteins or as a drug. A lot of such kind of industries are USA is running. There, I think these sites, this area is not covered today. I think maybe in future, ISBM will take care of that, particularly because this is a big area of biotech industries. Dr. Mr. Nov, he has mentioned that we have some limitation in our curricula. I mean, in recent times, we can adapt, we can develop our curricula. This job in the pharmaceutical industry is mainly very much concerned with the quality control only. And quality control, in microbiology quality control is very much specialized a job. Our microbiologists, particularly the microbiologists of Dhaka University and public universities, they are not that ready. And also we are lacking, I mean, our curriculum is still lacking, I think. What I would appreciate in future, I mean, you have to address or we need to address, it will benefit Bangladesh microbiologists also to, I mean, the microbiological product, pharmaceutical product, if we could address those things, then many microbiologists, they could get the opportunity to get their job.
Dr. Haq, sir, your comments are being noted, and thank you for your great suggestion. We'll consider this in our future webinar. I think your suggestion is great, and we're going to consider.
Yes, thank you very much again, Dr. Mozammel Haq. I have one general question, and this is directed towards all speakers. Since your presentation was very insightful, this is from Dr. Habib Bak, by the way, since your presentation was very insightful and was very informative, will it be made available via Facebook and through ISBM webpage?
Yes. And all other speaker, if you could, there is a yes sign over there. If you can just check it yes by the participants, that you will see a green button. Say yes. If you click yes, that will help us.
Okay, I think the next question, is there any age limitation to join the industry, and what is the good age to move academy to industry? This question is from Noor Alam Siddiqui. Is there any age limit?
My experience in industry is just for 2 years, so I'm not in a position to answer that question. Maybe Hassan, you can answer it.
It's for the US, right?
Yeah.
Yes, in general, there are no restriction. Nobody asks for restriction. They typically, job advertisement has, a certain years of experience in educational and some skill set. But if you have 8 years of postdoc and then you apply for pharmaceuticals, what happened? Things does not like kind of build on your achievements. And basically, but still, again, there are always exceptions. It's not that it is impossible, but typically entry to industries, because you want to enter into entry level, enter and then excel. But if you enter too late, like after 10, 15 years of your postdoc, you enter to an area that your colleagues are like, it's not a very good fit, because after a long time in an academic research and going to industry research, which is Aftab nicely pointed out that there are 3 or 4 areas that are fundamentally different. Overall, they have kind of a similar objectives, but the speed of the research is so different, and the method of funding, and also very basic versus applied research question, and also freedom to publish. Like in academia, in pharma or biotech, you have to think about IP issues. You have to make sure your intellectual property is secured. So there are kind of a dynamics. Therefore, I advise that you get early on, after 2 or 3 or 4 years of postdoc maybe. But if you are too late, like in your mid-career age or late career age, then you can definitely, certainly possible to enter, but your attractiveness is a little thinner, in my opinion.
I'll just add to this, and also it's basically looking at many different examples. So if sometimes we are too late in making the transition, we are doing academic research, but at some point we are thinking that we have to make a move. So if that decision has been made, then we can always do that by maneuvering our current research towards a trend in the industry. So for 1 or 2 years, we can always change the trajectory of our research and look at the industry trend, and then kind of custom make our goal and research goals so that it can fit the industry very well. So that can be done at any time.
And also, if you can, academic research, you often have a breakthrough finding. If you can make a breakthrough, then it doesn't matter what age you are. You will be actually requested, and you will be invited with a red carpet to industry anytime.
So let me add on to that. I think I have seen people transition across the spectrum from coming out, so in your late 20s, once you've finished your bachelor's or master's, and then 30s and 40s. What I've not seen is people transitioning, I'd say probably after the age of 45 or 46. And here's why. When you're at that point, you probably have another 15 or 20 years left anyways of productive work that you can put before you hit retirement. And and it's a two-way street, right? The company wants to know if it is worthwhile taking that risk, and with someone who has that much of a duration or a window, versus somebody who has another 30 years of runway, and even for you professionally, it depends on what your aspirations and goals are. But typically 45 is where I've seen, kind of the line gets drawn unofficially for that transition, and for them to be accepting, unless you really have an exemplary record of, having done some breakthrough research, and then, a company wants to recruit you as a scientific officer, or somebody to direct, lead an R&D group and so on. I wanted to make another comment. So those of you who are looking at transitioning into jobs outside of academic research, typically what we tend to do is we wait until we are ready to apply to start looking for jobs. I would suggest, turn that upside down. In your free time, go on Indeed or Monster or whatever online job search engines are there, wherever you live. Periodically go and keep checking them out. Learn, what the industry or the employers are looking for in terms of experience, in terms of any special skills that they want from candidates. That'll allow you, if you start doing that maybe even 2 years before you actually apply for a job, it will allow you to create and craft your career and your learning opportunities to be able to kind of fit to that goal when you're ready to do that. If you wait until you're frustrated in the lab and then you decide, well, I'm going to switch to an industry, and then you start looking for it, you will very quickly learn that you probably don't meet a lot of those criteria. So, be inquisitive, learn, and one last thing I'd say is don't get comfortable. It is easy for us to, especially in working in a lab, to, spend as much time as we do in the lab. You will get tired. It'll be hard to find the drive to work on some of these additional things like networking, communication, additional skills that you may need, or explore and research and build yourself. But, and part of it is also the newness of it, right? I mean, as scientists, we are trained to be focused on one thing, and, and we naturally tend to become very introverted, and because just of the lack of time. But listen, I'm an example. If I can do it, anyone can do it. And I showed you what my background was in terms of my scientific research and all of that. Part of it is being at the right place at the right time and knowing the right people, but you will not get to the right place at the right time without effort. And there is no better way to start than today.
So if there are no more questions actually, so thank you very much. Thank you all to all the speakers for answering the questions with your wonderful insight. I would like to present a poll for everyone to participate. But before, I would also like to remind everyone that we will be organizing another upcoming event for clinical and diagnostic microbiology. It will also be a career session. So please stay tuned for more information upcoming through email or via Facebook. So Dr. Hassan, will you be contacting the poll?
Yes.
Okay. Okay. Yes.
We have pulled together a 6-question polls, and I will request everyone to participate. But before that, I have to do a few other stuff. Let me start the poll. Okay, you will get around 1 to 2 minutes to answer all the poll and see whether you can see the questions. And let me know if you all can see the questions. Remember, there are 6 different questions, so you have to scroll through up and down to make sure that you have covered all of them. So it looks like the majority of like attendance is from US, Canada, followed by Bangladesh, and like few from Middle East and Australia. We've seen that most of the almost 76% attendance are for employed professionals, and the rest are actually PhD, masters and bachelor students. We've seen that interest of attendance came mostly from pharma industry, 59%, followed by biotech, 41%, academia, 34%, and research institution, like 21%. And what type of content do you used to see in future? And people wants to see business aspects the highest. Second is wet lab. Third is dry lab career like bioinformaticians, genomics, and also fourth is government. Do you recommend shorter or longer sessions? 62% thinks that the duration was right, and 7% thinks that it should be longer, and 31% prefer it to be shorter. No, 31% actually, yeah, prefer it like little bit shorter. And almost 70% highly liked the student webinar experience, highly likely, and 30% says likely.
we are going to end today's session. I must thank all the speakers for their time and therefore very insightful presentation. I especially thank Mr. Nob Bhai for being so late at the night, and Dr. Nagesh for California Eastern West Pacific time is early in the morning. And I also thank all the audience for their participation. Without the audience, this would have not been possible. So thank you, the audience, and thank you for all the insightful questions. And I hope that you enjoyed the session. And please, if you do, please join our ISBM Facebook group. Please join our email group. And please let us know what you think about us. And with that, I would like to end the session.